Hello everyone, welcome to another day of USMLE, high yield USMLE questions. Today we are going to be talking about endocrinology. So we have a 45-year-old male present to the hospital with muscle weakness. The patient's BMI is 32, so the patient's obese. Vitally, blood pressure is 150/90, so blood pressure is elevated, pulse is 70, which is okay, and temperature is okay. On examination, the patient has an obese abdomen with abdominal striae. And there is proximal muscle weakness. Late night salivary cortisol is elevated, so that's Cushing's. ACTH is also elevated, so then we have to know that it is ACTH dependent Cushing's. Low dose dexamethasone suppression test did not lower the ACTH level, so that confirms that it is Cushing's. While high dose dexamethasone did lower the ACTH levels. So which of the following will likely be seen in this patient? So this is definitely a really typical scenario of Cushing's. They can give you a lot of features of Cushing's in the question stem. They can say hirsutism, they can say abdominal striae, hypertension, they can say insulin resistance, high glucose levels, so hyperglycemia. They can give you a lot of those things. So here I've put some of the features that they can give, like muscle weakness. So let's talk then what they're asking. So a few things you should know. First, let's talk about them. So first is that if this is the let's say the pituitary, right? The pituitary releases ACTH, and then if we have the adrenals here, the adrenals which are on top of the kidneys, so the ACTH will come here and it will cause the adrenal gland to release cortisol. So now a few things to keep in mind. If the Cushing's is because of an adenoma here in the adrenals, then adrenals produce in the pituitary. If there is an adenoma in the pituitary adenoma that is secreting the ACTH, then that one is called Cushing's disease. It has a separate name. The other ones are called Cushing syndrome, and so if this is producing ACTH, let's say, and then there is also some other, because this patient has elevated his ACTH, so now we have to know what caused the ACTH elevation. So one thing is this, Cushing disease, the pituitary adenoma. Another thing is ectopic ACTH. Ectopic, usually that's cancer, usually of the lungs, lung cancer. So this here is going to produce excess ACTH. So now, how are you going to differentiate that this ACTH is coming from the pituitary or is it coming from the lung cancer? So for that, you do the high-dose dexamethasone suppression test. Remember, a low-dose dexamethasone suppression test is just the initial test that kind of confirms that it is Cushing's, but it does not tell you if it is Cushing syndrome or if it is Cushing disease. So if the high-dose dexamethasone suppression test, if it suppresses ACTH, that means that it is a Cushing disease, that is the pituitary. If it did not suppress, so that will be this. If it did not suppress ACTH, the high dose dexamethasone suppression test, then it is the ectopic ACTH. Here it did suppress, right? So that is pituitary. So most likely the patient is suffering from this Cushing disease, pituitary adenoma. So now another thing to be aware of, so when you have ACTH due to any reason, elevated ACTH, it will kind of stimulate this pituitary. It will just stimulate it so much that it will undergo hyperplasia, and both of the adrenals will undergo hyperplasia. So ACTH elevation due to any reason, it could be lung cancer, it could be the pituitary adenoma. So it will cause bilateral hyperplasia of these glands. So now let's talk about the options. So bilateral adrenal atrophy, that is a wrong answer, and the reason for this is because this is going to be seen in exogenous steroids. So now let's say someone is let's say this is your adrenals, and let's say exogenous, right, which is the most common cause of Cushing's. If someone is taking exogenous steroids, let's say exogenous steroids are used, and they are gonna go to your pituitary and suppress ACTH. ACTH decrease, there is no action of ACTH on the adrenals. The adrenal eventually will undergo atrophy. So there will be bilateral atrophy of the adrenals because steroids, exogenous steroids, suppress ACTH. That results in this. So this is definitely not exogenous, right? Because ACTH is elevated, it is not suppressed. So that rules it out. Then bilateral adrenal aplasia, as we discussed, this is the right option. Then adrenal adenoma. Adrenal adenoma, again, if let's say we have the adrenal here, and the adrenal is has this tumor and it is producing cortisol. Again, this cortisol is going to go to the pituitary and suppress ACTH. So that's actually going to present with low ACTH. Then another option is adrenal carcinoma. Again, the same. If there is a carcinoma here that is producing cortisol, the cortisol is going to go and suppress ACTH. So ACTH should be low. In the question, it is high. So then unilateral adrenal atrophy. So this is interesting. So this is going to be seen, for example, if you have one adrenal here, and let's say this one has the tumor, right? And the tumor producing cortisol. Cortisol is going to the pituitary, and decreasing ACTH. So this adrenal adenoma going to the pituitary is decreasing ACTH. There is no ACTH here, so it will not act on this pituitary, and this is going to undergo, the unaffected one is going to undergo atrophy. The one with the adrenal adenoma is going to continue secreting cortisol. That is going to suppress ACTH. There is low ACTH, so the other unaffected with the adrenal without the adenoma will undergo atrophy. So hope this question was helpful, and if it did help you, please like and subscribe. And if anyone wants tutoring, you can email me here.